What are the signs of diverticular bleeding, and is it serious? Imagine suddenly seeing bright red blood in your stool or on the toilet paper without any warning. That's often how diverticular bleeding shows up. It usually causes a quick, painless burst of rectal bleeding that can be mild or quite heavy. The blood is typically bright red or sometimes dark maroon and might come out in spurts or as clots. And like some other digestive issues, you might not feel any abdominal pain or discomfort when bleeding occurs. People often notice signs like a sudden onset of bleeding that can come and go or be continuous. If the bleeding is heavy, you might feel weak, dizzy, or lightheaded because of blood loss. This is especially true if the bleeding is significant enough to cause a drop in your blood pressure or lead to symptoms of shock. It's important to remember that most cases of diverticular bleeding stop on their own, but some can be more serious. Seriousness depends on how much blood is lost and how long the bleeding lasts. About 10 to 20% of people with diverticular bleeding may experience enough blood loss to need medical help. Large blood loss can lead to anemia, which is a deficiency of red blood cells, or hypovolemia, which is a low blood volume. In severe cases, this can cause dehydration, fainting, or even shock. Rarely, ongoing bleeding might require hospitalization, blood transfusions, or procedures to stop the bleeding, such as endoscopy or surgery. If you notice any signs of rectal bleeding, especially if it's heavy or persistent, it's crucial to seek medical attention promptly. Doctors will usually perform a physical exam and blood tests to evaluate your condition. They might also use procedures like colonoscopy or imaging scans to find the exact source of bleeding. Treatment depends on how much blood you've lost and how long the bleeding lasts. Supportive care with fluids and blood transfusions may be needed, and in some cases, doctors can use special techniques during a colonoscopy to control the bleeding. Surgery might be necessary if the bleeding continues or if there's a risk of further complications. It's important to understand that diverticular bleeding is a different problem from diverticulitis, which involves infection and inflammation of the diverticula. While diverticulitis causes abdominal pain, fever, and systemic symptoms, diverticular bleeding usually occurs without pain and is caused by the rupture of blood vessels within the diverticula. Both conditions requiring medical attention, but their treatments are different. In summary, the key signs of diverticular bleeding are sudden, painless rectal bleeding that appears as bright red or maroon blood. It can be serious if the bleeding is heavy or ongoing, so getting medical help quickly is essential to prevent complications. Always consult a healthcare professional if you experience rectal bleeding to ensure proper diagnosis and care.